now come to the demonstration part. Here, home learners, if they have chosen to undertake the competency part of the course, we will be practicing step by step the art of venipuncture on a prosthetic arm. So the equipment we have here is the prosthetic arm, which is attached to an IV system. Within the bag we have squash. You can use water with food colourings in. You just need to be able to see the fluid within the tubes, because once we've taken the sample you will be able to see that it is coming into the tube, so you know you're successful within the procedure. So we will start by popping on our gloves. It is infection control guidelines that you are to have gloves on before you touch a patient. So in practice, it's good to start as you mean to carry on. So gloves on. The equipment we need is a tourniquet. This is a disposable one with pre-made holes and a plastic clip. You just hold between your thumb and forefinger and release the tourniquet from the clip. When you're applying the tourniquet to the patient, the smooth side of the clip needs to be against the skin. So as we pop it on, slide it under the patient's arm, bring the clip into position, and then you pull it tight. The clip goes into the pre-made hole and we're ready to fill for a vein. Use the base of your forefinger, never your thumb. So you just press lightly. You're feeling for a soft and spongy bounce underneath the skin. Once you've located the vein and you're happy, we then come back over to the equipment for our alcohol wipe. You release that from its packaging and wipe the vein for 30 seconds. You allow that to dry while you assemble your needle and vacutainer. This is a double-ended needle. You take the grey cap off first by twisting it, and that will release the needle that is covered in a silicone protection. You screw in the needle to the vacutainer. This part here is for once the procedure is finished. It's a safety catch which will go over the head of the needle. When you're holding the needle, you place your 2 fingers at the bottom and your thumb on top of the vacutainer. This will give you a nice stable base against the patient's arm, and also while you're putting the bottles on and taking them back off. So you reveal the needle and you have a bevel at the top of the needle. This always needs to be facing upwards when inserted. So we've felt the vein, we know where we're going, and we insert the needle at a 15 to 30 degree angle. Needle inserted, just the very tip of the needle needs to go in. We come back to our tubes. For this demonstration, we're going to take an I&R. Now it's really important that it's filled to the black arrow. If this is underfilled, this tube will be discarded. When placing the tube onto the vacutainer needle, you can hold it between your fingers or with your fingers underneath and the thumb on top. Place it in, pop your thumb on the end of the tube and your fingers at the end of the vacutainer and push. You will get slight tension, but as you can see, the fluid is coming into the tube. So we're in the vein and we're obtaining the sample. This tube is filled to the indicator mark. So what you will do now is go through your order of draw. We have an LFT which will go in a gold bottle. Again, thumb at the bottom, fingers at the end and a slight push. Whilst you're in the patient's arm, you need to keep the needle as still as possible. Once that's full, forefinger at the end, thumb at the top and push against your thumb and release the tube. Purple would be your FBC. Again, between your fingers to pop on, thumb at the end, and fingers for traction. It's always good to have the clear part of the tube, the space between both sides of the label, facing you so you can see the fluid coming in. Once that's done, you release the tourniquet before you release your needle. Get your cotton wool, place it above the needle. Do not press on the cotton wool until you have withdrawn the needle. Now once you need to cover your needle, do not do it with your hand. You come to a stable surface and press down. You'll hear a click and the needle is safely guarded so to reduce the risk of needle stick injury. At this point, you could ask your patient to hold the cotton wool whilst you do the admin side. For this purpose, we'll just leave it there. You find your tape, just a little bit of tape to secure the cotton wool in place. You must check after the 2 minutes of pressure that's been applied that it's finished bleeding. Once it's finished bleeding, pop the cotton wool back on and the tape over the top, and your patient is free to go. This demonstration will show you the technique and equipment that you need to bleed either the wrist area, forearm or hand, and also can be used in feet. You take your tourniquet with the pre-made holes, pop it off the clip, ensure that the smooth edge of the clip is against the patient's skin. Feed it under the arm, above the site, at least 2 to 3 inches. Place the smooth part of the clip onto the patient's skin and pull the tourniquet around, affixing the clip into the pre-made hole. Once you're there, you can feel for the veins. We tend to try and bleed the patient from the top of the arm, as further down the arm, hands and feet can be a little bit more uncomfortable. But sometimes it's what needs to happen. So once you've found your vein, you take your wipe, release it from the packaging and wipe for 30 seconds. You allow that to air dry. We're going to use the butterfly collection set this time, which comes in packaging like this. Just pull down from the top and release the collection set. You can place your rubbish either into your tray, or if you're on your clinical area, you will have a clinical waste bin within reach. The butterfly here comes with a needle, the wings, which helps you insert the needle, a retractable part to bring the needle down once we've finished. The long tube brings the sample into, on this occasion, a syringe. With the infusion kit, you can also use a vacutainer. So once we've decided where we're going to go, release the needle. Again, bevel facing upwards. Hold the butterfly in your dominant hand, pinching the wings together. And you find a comfortable way to hold the syringe. You insert your needle at a 15 to 30 degree angle with a smooth motion. So once inserted, keep hold of the butterfly wings. Your other hand with the syringe, just push down on your thumb and you will see the fluid coming through the needle, down the tube and into the syringe. Take as much of a sample as you need. Sometimes, depending on the request, you may only need 2 mils, 4 mils, 5 mils. Take what's required, and once you're ready to release, you can hold the syringe in your hand, release the tourniquet, and you're ready to bring out the needle. Again, pop the cotton wool above the needle, Once you have taken the needle out of the hand, press down. Now you have your butterfly with a retractable needle. Press either side and bring the sheath over the needle. Again, this is for safety reasons and reduces the risk of needle stick. You then have your sample in your syringe. Pop the butterfly collection off. Get your sample bottle, pop the lid and press in the plunger to transfer the sample into the tube. Replace the lid and your sample is ready, once labelled, to send to the lab. With your patient, make sure they've finished bleeding and attach tape or a small plaster and your patient's ready to go. Thank you for watching the video of venipuncture being practiced on a prosthetic arm. This video will help show you the technique and the exchanges of bottles. This is your learning tool if you choose to select the Competencies Phlebotomy course. Please only practice on the prosthetic arm. You are not competent for human collection unless it's under the supervision of a health professional.